minutes past 8 a.m. A very good morning to you, and welcome to Morning Cafe, away from matters, politics, and the whole heated conversations of matters, siasa. This particular morning, we do have right minds to discuss matters pneumonia. Now, on the 12th of November this month is World Pneumonia Day, and this particular morning we'll be having a whole bias on matters children and other groups that are really inclined to have pneumonia. Talk about the whole elderly. And just to introduce guests this particular morning, on my left, Lilian Mutua, Head Health Promotion, Nairobi City County. Karibu sana. Morning. Nairobi inaendeleaje?
Mvua lakini tunajikakamua.
All right. Dr. Janet Karimi, Head of Newborn and Child Health Division, Minister of Health, Kenya.
Morning.
I'm made to believe this particular division is quite new.
No, it is not new. Mm-hmm. It has been there for a long time.
But then last year there was a Head of Newborn and Child Health sort of plan.
We've had a newborn and child health plan for a long time. There was just a restructuring the last year, okay. But the division has always been there.
Right.
Yes.
So the whole restructure for 2022 to 2026?
Yes.
All right. We'll be getting into that later. And finally, Florence Njeri Nduati, pediatrics clinician.
Thank you. Thank you so much.
Even as we start with this particular conversation on matters pneumonia, allow me to take you through some data as we run through the UNICEF. It's about 51%. Between 2000 and 2015, pneumonia mortality rate declined by 51%. But it is one of the lowest rates of decline as compared to other diseases. And 16% of all deaths under 5, so 922,000 deaths. According to UNICEF, gives you also other bits there. And finally, 6 out of 10 childhood pneumonia deaths are concentrated in 10 countries. First of all, the fact that even focusing on matters, as I started saying, we really have a bias on matters, children. But let's start with the basics here. Start with you, Lilian. What is pneumonia, basically?
This is a lung disease that can be caused by either bacterial infection, fungal infection, amongst others. And why we are focusing so much on children is because we find that this is one of the great killer diseases for children. More than we do get both combined for HIV and malaria in our country. So when we look at the gravity of the disease, then it makes us have special attention. And we know that oxygen is important for everybody. So if a child is not breathing well, they may develop other complications and probably leading to death. And we also have seen that most of these children are brought to the hospitals or health facilities very late because the mothers might not really clearly understand the signs and symptoms, and at times, most of them, the parents and the caregivers might go for options of over-the-counter self-prescription medicine. Mm-hmm. So by the time the child is coming, they are severely deprived of their breath, and we've seen most of them lose their lives.
Right. Dr. Why really focusing on children? And also, even as you answer that, what's the whole significance of World Pneumonia Day, according to you?
Okay, so I'll start with the significance of World Pneumonia Day is to raise awareness on the disease condition, and more so to let the community know, the families know that pneumonia can be prevented, that pneumonia can be treated early. So when there are those signs and symptoms of pneumonia, as my colleague Lilian said, we need to actually seek care early from the facility so that we don't get into severe pneumonia where now we have deaths resulting from that. That is the significance of the World Pneumonia Day. It's very important because children are, it's common among children. It's a leading cause of death among children. It actually accounts for about 15% of the deaths in children. So if we are able to address that, then we can reduce the number of deaths in children for under 5 and also for the newborns. So this day we want to create that awareness that pneumonia can be prevented, and it can be treated if you seek care early.
Right.
Yes.
And pneumonia is one, it can be an underlying factor.
Yes.
When we talk about matters COVID-19. To take you back to matters COVID-19 and when, the country was really grappled with this, virus. What kind of lessons, how was it, tackling, on one hand,
check one,
we really
two, one,
talk
two,
about
check one,
fighting
two. One, two,
pneumonia,
check one, two.
but then COVID comes. So how big of a deal was it at the time?
Yeah, COVID-19 came with the
one, two.
whole aspect of how to treat the respiratory illnesses. And number one being the oxygen availability in the facilities. It helped a lot because some of the facilities never had the oxygen.
Thank you very much.
The oxygen facilities, they didn't have the parameters to measure the oxygen levels. But with the coming of the COVID-19, facilities were equipped with such equipment, and they're able to tackle pneumonia basically. And COVID also brought again the whole aspect of just doing a thorough exam on the children and also on the people affected by the pneumonia, because the two diseases mainly affect the lungs. And so when the COVID came, it widened the aspect of clinicians being able to just check the oxygen levels and find out how the patient is doing, and also making a good diagnosis of pneumonia or any other illness that is affecting their lungs.
Were we really prepared for this, really?
I really wouldn't say we were really prepared, but for the pneumonia, we've been doing quite well because there's also the vaccinations against pneumonia that was launched in 2011. But for the COVID, just like the world was not prepared, we were also not very prepared, but we were able to handle it well because not many children who succumbed to COVID, as opposed to the ones who succumbed, as opposed to the adults who succumbed to COVID.
I'm taking a look at, as of mid-May 2021, about 3,000 deaths. For children, it was about 27 deaths out of the 4,535 cases. And now allow me to even narrow it down. You come from 047 right in Nairobi. What are vitu ziko ground zikoaje? How are things on the ground? Because you really interact with community health promoters around here. You really walk around the city. How is the situation like in Nairobi?
I would say in Nairobi we are privileged to have 7,500 community health promoters, and in one of their learning modules there is issues of respiratory disease, of which pneumonia is one. And I'd also say that our clinicians, our doctors, our nurses, and other health workers have been taken through the integrated childhood management of illnesses, where pneumonia is part of it. And for our community health promoters, they also help define what pneumonia is at the household level, that is at the community. And this is by clearly telling people the signs and symptoms of pneumonia so that they don't delay to seek medical attention when a baby is sick. And normally for the community health promoters, we do not even just say about pneumonia or respiratory illnesses. We are emphasizing that any parent, any caregiver, any guardian, if a baby is not feeling well, and the signs that you'll normally see are maybe restlessness, a child being dull, not being able to play, inability to feed, you immediately go to the health facility other than just watching or doing self-medication. And we also are looking at the issues of indoor residue pollution, where people are using the kerosene stoves, the charcoal burners in the house, which emit a lot of indoor pollution. So we are also helping people learn that if they have, those are the only facilities they have for cooking fuel, they'd rather do it from outside the house. And also telling people to be aware of the households having proper ventilation. We also have people who live with their immunity is a bit deprived because of different diseases. We also do regular follow-ups at home, and they also have appointments in their respective clinics. So for us, when we look at pneumonia, we are even paying very special attention to the newborns. And this is one of the health education information that is passed to mothers when they are still in the maternity wing before they go home. So it is a continuous process, and very much emphasizing on children who are 5 years and below, because these children are voiceless. They will not know how to explain. Yeah. It's only a parent, a guardian, or a caregiver who needs to put special attention. And for us as the health promotion team, we are taking it a notch higher to even the ECDs, where the ECD teachers and staff need to recognize when a child is ill and pay special attention by either calling the parent, the caregiver, or the guardian, or immediately taking them to the nearest facility. So in all our communities in Nairobi, at least we have a link public health facility. And we really appreciate our governor for Nairobi, His Excellency Governor Sakaja, because he's even been able to make it possible to have a newborn intensive care unit within Nairobi, which can serve the very severe cases.
But then, and allow me to interject, it's one thing to tell people, so look, in your household, do not light the jiko here, because you probably have a 3-year-old child in this house, or even for his safety. But it's another thing for them to actually follow it through. If you look at even the whole planning of some of these apartments, how they're built, they're not really built for you to actually even light jiko even outside maybe, or even have enough ventilation. I mean, you'd do a good job, really sensitizing, but then having a follow-up. Are these things really implemented?
On the ground, I'll say it's about selling the benefits and importance of reducing indoor residual pollution. So once we educate the people and they have the buy-in, they take it upon themselves and do that role. We've seen even people come with small makeshifts of a place where you shield, where you can put your jiko and cook from there, from the corridors, from the balconies. And we would really appreciate even if the government, the national government, and the energy sector and ministry would look at reducing the prices of the clean fuels, the green fuels, for use at the lowest level. Because if it was made cheap, like if the gas was made cheap, and electricity made cheap, people would go for that.
All right.
So it's multi-sectoral, multidisciplinary.
All right. Dr. And even as you come in, I mean, you're from the Ministry of Health, yes. The government, basically. Even as you chime in on what she talks about, last year, yes, Nakumicha, during the same function, Matters World Pneumonia Day last year, she was talking about pneumonia is easily treatable and preventable. But then my question is, why is it the fact that, I mean, it will be treatable, it will be easily treatable and preventable, but why is it that it is the leading cause of deaths? Okay.
So first, let me start on the prevention aspect. So the lack of knowledge is now contributing to the transmission of the disease. So for example, we start at the community level. For the ministry, we are working at community level and facility level. So prevention and why the community health promoters are important is to raise awareness in the community, because that is where it starts. For example, simple measures like exclusive breastfeeding will give immunity to the child so that then they can fight diseases when those diseases are there. Simple measures like hygiene and hand washing prevent pneumonia. And COVID taught us that it can actually be prevented, because when COVID came, people were wearing masks, people were social distancing, and the number of cases of pneumonia seen at the facilities actually went down. And this is because of those preventive measures and the reduction of the indoor air pollution. So there are simple measures. There are the clean cooking stoves right now. So the community health volunteers or promoters will then give this message to the communities, and that will be one way of preventing. So the disease is there because, one, of lack of awareness. Two, we have poor health-seeking behavior. So we've had a lot of cases where a mother says the child had a cough, and then we said, let us wait for the next day and see how they are. Then let us wait for the day after that. So according to the Kenya Demographic Survey that was done in 2022, it showed that 82% of caregivers whose children had acute respiratory infection went to seek care, which is good, but only 43% went on the same day or the next day. So that shows us there is that delay. Why? Because of the lack of awareness. That is why the community health promoters are so key in telling us, when you see that your child has cough and then now there is difficulty in breathing or fast breathing, then you seek that medical attention first. So if we bridge that gap of lack of awareness, empowering the community members to seek services, then we'll be able to reduce the number. So the other thing my colleague mentioned, that before COVID, I think our availability of oxygen was also a bit low. Okay. So when we come to the facility late and we get late cases, those children will need oxygen as part of their management. So with the improvement in availability of oxygen now in all the facilities, especially piped oxygen, then we will decrease the level of mortality due to severe pneumonia. So when you take care of business at the community level and improve our quality of services, availability of drugs, availability of oxygen for medical use, then we'll be able to reduce that mortality. And as you mentioned, the cases have actually reduced over time, but we can hasten the process so that we reach our targets to reduce the under 5 mortality.
Right. And Jerry, as a pediatrics clinician, hypothetically, if I'm coming with my child who's maybe 3 years old, so what's the whole process? I mean, she's talking about the whole delay here. And now, even from your experience, I mean, you're the right mind to talk to on this. So the parent comes with the child, maybe under 5 years. So what is done, the whole process there?
Yeah, if I may start with the biggest challenge that we've had is late diagnosis, because mothers will tend to bring their children late. But what we say, initially when your child is just having cough and difficulty in breathing, or even just a cough, it's good to seek medical attention. Because when you go to the hospital, then they'll be able to classify your pneumonia, or they'll be able to classify your disease. Like when you come in with a cough with difficulty in breathing, already that's pneumonia. So that is when you come to the facility, we'll check your oxygen levels, we'll try to get the history for how long the cough has been there. We'll also try to find out, is there indrawing, is there chest indrawing, then classify the pneumonia, classify what disease you're having. Because some of these coughs could also be due to other diseases, could also be due to asthma, could also be due to other diseases. So when you come in, we try to find out if you're having pneumonia. And we've said pneumonia is as simple as just cough with difficulty in breathing. Then the other symptoms will come in. When there is fever, there is refusal to breastfeed, there is grunting. What is that? The difficulty in breathing when your child is producing some sound. And also maybe the baby is not breastfeeding, and you come in and you're able to classify. When you classify this pneumonia, then we shall know, are we going to give you medications to go home? Are we going to tell you there is no pneumonia? It could just be a cough, and we tell you just to go and try home remedies, which are easy, just warm water and breastfeeding. And if there is pneumonia, then the good thing about the treatment for pneumonia is that pneumonia is very easily treatable. And with this, we can applaud the ministry and we can applaud the policymakers, because they have made these drugs available. Right. And the drugs are available and they are cheap. And at a lower facility levels, they are even free of charge.
Right, you can finish that, because okay, allow me to interject you, because now I'm curious. As someone who's speaking for Nairobi, yet some parents would say that I cannot really access some of this, or rather, I can access, it might be just, there might be a hospital just outside where I live, but then the drugs are really expensive, matters insurance. Probably I earn maybe 500 at bob a day, and maybe the hospital is seeking even more than that. So how much how much do these drugs really cost in your experience? Is it really accessible? And is it really cheap, as she talks about?
I'll say we have different levels of healthcare all through, from level 1, which is the community, where we are doing a lot of education and information for the communities, as far as even the household, the workplaces, and even social amenities. And we also have the health centers, dispensary and clinics Then we have the county referral hospitals all the way up to the national referral hospital. So at the list where we have the level 2, the health centers and clinics, we are able to provide these drugs, and they're at no cost. So you are not charged for medication. What you need to do is to avoid self-medication, buying drugs over the counter, and ensuring that your child is clinically examined and diagnosed, and if it is pneumonia, it is treated. If it is any other disease, still you are able to know and the correct and appropriate medication given. I'd also say part of our information and education to public is not every cough, not every runny nose needs medication.
All right.
Because that is one of the issues that we are doing. When you're doing these household visits and even talking to the community members, they really like buying a lot of cough syrups for their children, buying antibiotics over the counter, and this is one of the ways that you reduce the immunity of your child. Right. So let your child build some resilience, and also if they need medication, let it be appropriately prescribed by a medic. So if you know that you have any cough syrup in your house, if you have any antibiotic that you have bought, kindly at this moment today, just dispose of it.
All right. And on that note, when you talk about correctly being prescribed, I'm taking a look at the National Newborn and Childhood Health Strategic Plan 2022 to 2026, which states that only 35% of children below the age 5 are being treated with the recommended amoxicillin DT. I'm curious, why is this, and why, if 35% is quite a short, if we should be aiming higher? All that after this short break.
Edition of the Kenya International Theatre Festival is here. Expect lots of local performances from Uasin Gishu County, Nakuru, Embu, Kisumu, Mombasa, Kiambu, and Nairobi. Also, great international performances from Germany, Italy, Malawi, South Africa, India, and Tanzania, with the vibrance of culture and art perfectly infused in this edition. Karibuni nyote! Grab your tickets from kenyabuzz.com, ticohub.co.ke, viewtickets.viewsasa.com. Twende Theatre Tukutane Kidfest 2023.
Did you know that Mount Kenya University is the most affordable university in Kenya, where you can attain your internationally recognized degree within 3 calendar years? Did you know that we have the highest number of campuses in Kenya, equipped with state-of-the-art facilities to develop you academically and socially? Join the most popular private university in Kenya and start your fulfilling higher education journey. Mount Kenya University, unlocking infinite possibilities.
Minutes past the top of the hour. Thank you very much for sticking around as we discuss Matters World Pneumonia Day. In case you're just joining us, let me introduce real quick the right minds. This particular morning, Lillian Mutua, Head Health Promotion right in Nairobi, Dr. Janet Karimi, Head of Newborn and Child Health Division at Ministry of Health, and Florence Njeri, Pediatrics Clinician. And before the break, Lillian, we talked about the whole matters, the drugs, even advising parents and guardians to dispose of those drugs that are not really recommended. And I'll start with Njeri on this. Even before the break, you know, I was talking about the Newborn and Childhood Health Strategic Plan 2022 to 2026, which talks about only 35% of children under the age of 5 are being treated with the recommended amoxicillin DT. So this particular survey was done maybe even before 2022. I'm made to believe right now the 35% might even be more. Talk to us about that.
Yeah, that 5%, currently we are at 51%, and that can be attributed to the uptake of the amoxicillin DT amongst the healthcare workers and even the parents. The parents appreciate it more, that it works better for their children, and also the healthcare workers are also obliged to prescribe because they can see the positive effects of the drug. The other thing is that the ministry has put a lot in educating the healthcare workers about the use of the amoxicillin DT. We've had so many trainings on the same, and we've also had so many people go for trainings, and even from the county level, and the amoxicillin DT has also been availed in most of the health facilities, starting all the way from the level 1 all the way to the level 5 hospitals. And it is doing quite well because there is a positive response. Children are getting better faster and even getting cured easily with the amoxicillin DT. And also considering the storage, it is easy to store as opposed to the other medications, the antibiotics that maybe may need refrigeration. So you find that that is where the uptake is higher, but we still aim to go to 100%.
Yes. Right. Dr. Ri,
yes.
Still the same question. Why the whole from 35% to about 53, 51%, and also why amoxicillin DT?
Okay.
Why was it really recommended?
Okay. So whenever the Ministry of Health recommends a specific line of management, it is evidence-based, research-based. So research showed that it is very efficacious in management of non-severe pneumonia, especially in our kind of setup. Dr. Ri mentioned things like storage, that we don't need refrigeration, and also how it is given, it is dispersible, so it can be sprinkled in water and just taken, or in food. So it makes it easier for the child to take in. We have developed and we review every 5 years our basic pediatric protocols. This is the guidelines on how to manage childhood diseases from the age of 0 to 5. And this gives a clear outline on how to classify the pneumonia. And if it is non-severe, then we recommend the amoxicillin DT. If then there are signs and symptoms to show that it is severe pneumonia, then we have the drugs indicated for that, the Expen and gentamicin. So these guidelines are critical. We issue them to all the healthcare workers, and it's a job aid basically, so that a healthcare worker doesn't have to cram what they should do. They see the symptoms, they look, and then classify, and it gives you what you should do. So every healthcare worker, from the nurses, from the clinical officers, from the medical officers, and the pediatricians use this. We also take training very seriously, and we train healthcare workers on integrated management of childhood illnesses, which is another guideline that we have, and it comes as a chart book. So it also illustrates how to manage pneumonia, among other conditions like diarrhea, malnutrition, to manage childhood illnesses jointly. We also developed the comprehensive newborn care guidelines. We also have pneumonia among the newborns, those who are 0 to 28, and we've also undertaken training of healthcare workers on this. So with this, our healthcare workers are actually our advocates, where they also advocate for use of the amoxicillin DT as the first-line management for non-severe pneumonia, so the uptake has gone up. Parents who also see that the children have responded well also will be more likely to advocate to other parents to get the correct medication from our facilities. So in government facilities, even private facilities, these guidelines are available, and they guide the direction of management for our children. So
does amoxicillin DT start from when you're prescribing it, from age 0 all the way to probably 100 plus? Or does it vary with age?
There are different prescription strengths for different ages, because for children, you give medication per kilogram. So it can be used from those who are 2 months to above 5 years, and the dosing is per kilogram.
But are these drugs available in the drugstores around Nairobi?
I will say the drugstores, I'll prefer to say in our facilities.
Facilities, okay.
But what I'm still trying to counter is when we say the drugstores, where people will now go and buy, maybe not self-prescribe the correct doses, and also where whoever you're buying from at the chemist has not examined their child and has not ruled out any other infections. So it is not that it will treat all infections that the child has. And we know that the children, even their internal organs are also very delicate. And we would not like to dose children with medication they don't need, because at the end of the day, any medication you take is excreted through the liver and the kidneys. So what are you doing for this young child who is not yet fully developed? So if a child needs any medication, kindly go to the nearest facility. If the case is severe for them to handle, at least they'll give the first aid management as they refer you to the appropriate place. So even if the child does not have pneumonia, maybe it's another severe disease, the referral and linkage will be done appropriately and efficiently to save time on the child going to severe illness.
All right. And Jerry, does it now depend on, for example, if a child aged below 10 years has HIV, now will you now not prescribe the amoxicillin and probably have a cotrimoxazole? I hope I'm pronouncing this medical terminology correctly. Yeah. But then now does it vary? Because I'm seeing even some of this research by UNICEF, they say for HIV children, they're given this other one.
Yeah, cotrimoxazole is basically not for pneumonia. It's for a specific, it's for prevention of a specific type of pneumonia that we call we used to call it the PCP, that is, but currently it's the PJP, which is a pneumocystic carani. But it is used for prevention for HIV children. It's not for treatment. So what we give is the amoxicillin DT, and I would love to clarify, the dosage that we use for pneumonia is not the same dosage that we use for other infections. So the dosage we actually call it the high dose amoxicillin. So when you go to buy over the counter, you'll just be either get the wrong dose or not get the right medications, because it's calculated as per high dose amoxicillin, not as per the common infections that we treat we treat using amoxicillin. So we'll treat the same way, but it will all depend with the weight per kg of the child. But cotrimoxazole is for prevention. Right. It's not for treatment. Yes.
And Dr. even as we are now really focusing on the future to ensure that we reduce childhood mortality when it comes to pneumonia, what's Kenya doing? What's the Minister of Health really doing when it comes to innovations on having even childhood vaccines around the same?
So you've given the first answer for me, the vaccination. Okay. So vaccination is key. We have a vaccination schedule for Kenya, and we're urging all parents to make sure that their children got all the recommended vaccinations. We have the mother-child handbook, which is given to all pregnant women, which is used for their follow-up plus that of their child from 0 to 5 years. So whenever they go to a clinic, it is marked that when is the next date for the next vaccination. So if you follow all your clinic vaccination schedules, you'll get the vaccines, including those for the conjugate pneumococcal vaccine, which is given at 6, 10, and 14 weeks. So that needs to be there, and that follow-up of that booklet is key to ensure that all the children are vaccinated. We are looking at pneumonia from all angles. Recently, we launched the universal health coverage through the primary care networks. So we are seeking to strengthen the linkage between the community and the facilities, so that we have our community health promoters who can educate the mothers, who can give, for those children who are ill, they can be referred quickly, and there's that linkage with the primary care facilities. So that primary care network and good linkage, we hope, will reduce the late referrals which come as severe pneumonia. The other thing the Ministry of Health is doing is working on the health financing aspect, because you need financing to ensure that you have the drugs, you have the qualified healthcare workers. So we have the Facility Improvement Fund Act, which now will legislate how funds raised from facilities, whether dispensaries, health centers, or hospitals, those funds will be used to will go back to the facility so that they can improve their facility in terms of being able to buy commodities, being able to run their own recurrent expenses. So in that way, availability of commodities should be improved. And with the insurance, that the Social Health Insurance Act, we are hoping that this will enable reimbursement of money to the facilities, which is what they'll use to run their expenses. So with that, we hope to reduce out-of-pocket spending, so that out-of-pocket spending is not a barrier to the mother taking the child to a facility, and that the facilities then are well equipped, they are well stocked with drugs. In this way, then, we manage it properly. So two-pronged approach, we prevent, but when we get the condition, we are able to manage adequately. Yes.
But then, so what happens now? Because I mean, seeing in some of these health facilities, really urging parents not to go for, over-the-counter drugs. So what really happens in, for example, a constituency where there's out of stock for the same amoxicillin DT, for example, in like a whole week or let's say 2 weeks. So what really happens there? How can you really advise the parents, telling them just remain calm? This is how we will handle the situation.
The beauty is that in all the facilities nationwide, we do forecasting for our medication. So before you are deprived of any stocks, you've already ordered the right drugs at the right time. And this forecast is made as far as 3 months. For Nairobi County also, we know that if there's any maybe medication that will be out of stock from our main facilities at KEMSA, then there's always a quick fix where a facility, through the correct protocols, is able to forecast that in the next maybe in few weeks, we might run out of stock of these drugs. So that is also looked at, and the facility are able to be facilitated to get the same provision. So it is not common to find that a drug like that for children will really be out of stock. The other thing, we are also urging the parents, just like Daktari said, to make sure they get their children vaccinated at the right time. So for the pneumococcal vaccine, the doses are given at 6, 10 and 14 weeks. So it is good for the parents to ensure that this is done and they get the children vaccinated at the right schedule. And also just making sure that communities are aware that pneumonia is a preventable disease. And let us step up on hygiene. We saw that during the COVID era, we didn't have as many children having pneumonia. And also let us emphasize on the mothers who are breastfeeding, making sure that their hands are clean before they touch the breast. So if a person is having pneumonia and maybe they cough into their palm or they touch surfaces where we have the pneumonia virus or any other bacteria, this is what is going to go to the baby, maybe when they're breastfeeding. And also in the schools, we are emphasizing on proper ventilation. If you look at mostly in the private schools, the ECDs, the daycare centers, the facility for ventilation is not good. So we are trying to have conversations just to see how to make it better. Right. We should also learn that not everything lies with the health sector. Like when we are looking at issues of indoor residue pollution, issues of ventilation, issues of housing, this is a multi-sectoral obligation. But when people get the pneumonia, when a child gets pneumonia, when everybody maybe gets sick, the buck stops with health. So we are also asking the other sectors to come in and address issues as is so that we all move together.
Right. And Jerry, even now for, let's say, the mother watching us this morning, and they probably, that daughter son has pneumonia, or rather, they just want to really, come into this whole fight against it. And you talk about vaccination in some whole complex words here. But then simplify for this mother. Why should they be taking their child for the whole vaccine, and at what age? And why will it really make a difference?
Yeah, vaccination was introduced in Kenya against pneumonia in 2011. And why it is quite important to vaccinate a child against pneumonia, because it prevents the invasive form of pneumonia, that is the severe pneumonia. What happens, the baby is vaccinated at 6 months. It was incorporated into a national vaccination schedule so that it is easy for the mother to come to hospital, at the same time get the vaccinations for all the others. So when at 6 weeks, that's when you get the first vaccination. It's pneumococcal vaccination. We call it PCV10 because it vaccinates against 10 strains of, there are different strains. A bacteria has different strains of infections. So it vaccinates against 10 of them. And it's at 6 weeks, and again at 10 weeks, and again at 14 weeks. So that is the same schedule that we have for the what we call the penta that has 5. It is the same schedule. You know, the way the mother is told, come back after this time, come back after this time. So you go back after 6 weeks, then you go back at 10 weeks, and then you go back at 14 weeks. And the vaccination is in form of an injection that is given at at the thigh of the child. It is very important to have your child vaccinated, because when your child is vaccinated, as opposed to that child who is not vaccinated, the probability of you getting a severe illness are less, because you're basically prevented against the pneumonia, the invasive form of the pneumonia. Yeah.
All right. And even as I get your final thoughts, for this particular, on the 12th of November, what will be the major focus on matters pneumonia, even as we move forward?
Okay, so 12th is actually on a Sunday. We'll commemorate the actual day on 11th in Nairobi, where we'll have a community health outreach showing the linkage between the community, the primary care facilities, and the even tertiary facilities in Nairobi counties. Our emphasis is the 3-pronged approach: protect the child through the breastfeeding, the sanitation, hygiene, and good nutrition, because the nutrition builds the immunity to fight against. So that is protect. Then prevent. We've talked about vaccination again, over and over again. So the vaccination is very key. Then early treatment. We say mapema ndio best. Treat early. So this will be our focus, and we'll also be launching the pediatric quality of care standards for all children, including the sick and small newborns, so that we improve the standard of care that we give to our children across all the disease areas, including pneumonia. So let us protect, prevent, treat early.
Right. And even before I come to Mutu, even for other groups that might really be at risk, I mean, the fact that we really talk about the children, but your thoughts on how we should really be even protecting the elderly, for example?
So for the elderly, it's all a matter of the immunity. So the same things, make sure that we have, for the elderly, also practice hygiene so that we don't transmit disease. Good nutrition so that you boost your immune system also for the elderly. And also where we are keeping them, let them have clean indoor air spaces, avoid the dirty fuels and use clean fuel. So they are the same approaches that we are using so that we boost our immunity and prevent transmission of disease.
Right. Muto, even as you chime in on the same, how to not only even children, but also other groups, the kind of challenges, the kind of unique challenges that Nairobi really faces when it comes to, fighting pneumonia.
We know that we have a lot of air pollution. For example, if you walk into the city, in the CBD, a lot of fumes because of movement of vehicles, some of them emitting very heavy smoke. Also looking at the industries around, looking at some places like Dandora, the Makadara, around the Viwandani, where we might have very high industrial pollution, and also from our garbage site at Dandora, where always there's smoke coming out of that place. So we'd really, and even the amount of people in Nairobi, the population, 5 million plus, with another 1 million transit population through the 24 hours in a day. So when we look at the magnitude of the population that we are living with, the urbanization, the development, the industrial pollution, we really have a challenge, and we need to look at the clean air and also ways to minimize the pollution, and looking at, even when we are discussing pneumonia for this year as 2023 globally, we are looking even at the space of climate change. So we really emphasize that everybody takes their role and responsibility in reducing the pollution, looking at our hand hygiene, sanitation standards, early positive health-seeking behavior, and working with other sectors, taking up community social responsibility, everybody to come into this space, because if a disease is preventable, then it's better to prevent as much as we can, because if you get severe pneumonia or any pneumonia, as much as we are saying that at our health facilities, the lower public health facilities, it is for free. It is actually not for free. The government pays for it. This is the taxpayers' money. And as much as we overstretch our health service provision in facility, it might also tamper with the quality. Right. So the lesser the disease, the better the quality. The fewer the numbers, the better the quality. Right. So let us all be taking up this challenge and reducing pneumonia in Nairobi, in Kenya as a nation and globally. And we shall be commemorating this day. Nairobi County is going to host the national commemoration of World Pneumonia Day on Saturday the 11th at Superloaf Primary, where we shall be screening children from below 18 for any illnesses, and just screening and seeing how many of these could be having pneumonia. All right. So Nairobi tuko sawa na itawak.
All right.
Lazima iwak.
Lazima iwak. And speak of lazima iwak, I remember talk about matters hand sanitization and all this, and it reminds me during the whole COVID time, it was really like a must when you're entering somewhere, there's sanitization and wearing a mask. I'm curious from the three of you, does wearing a mask really work?
Yes. It does.
It matters preventing pneumonia.
It does. And I'm urging all Kenyans, if you know you're having a cough, if you're sneezing, if you have a runny nose, kindly put on a mask. Fortunately, early this year, I went to one of the Asian countries. And like, people are just putting on their masks. And if they see you not in a mask, especially in the airport, they'll even just gaze at you, what's happening? Because that space, the population, you don't know who is next to you. Yeah. So let us not emit these infections to others through the air. Let us be responsible. All right. Hand hygiene, a must, a must, a must.
Lecturer, even as you pick up from that, matters the whole mask, your final thoughts?
It's true, and as I said, the numbers of pneumonia during COVID time were actually they were around 477,000 in the year. And after COVID, we went back to about 700,000. So you can see the importance of the mask, because predominantly the infection is respiratory droplet. Yeah. So if I cough and you inhale the bacteria in those droplets, then it will get into your system, into your lungs, and cause the pneumonia. So as my colleague Lillian has said, if you're having the cough, you're having a cold, please wear a mask. And I think nowadays I'm seeing more and more Kenyans doing that. Before COVID, there was no such thing. But nowadays you see someone with a cough wearing a mask, or they even stay at home. So let's continue that practice. Let's continue the hand hygiene.
All right. Jerry, your final thoughts?
Yeah, I would also love to reiterate the same, that a mask is very essential, especially if also in a crowded area, or even in a hospital setting, or even when you're having any of the illnesses. Pneumonia is preventable, pneumonia is curable. So sometimes you get a diagnosis of pneumonia and the mother is like, it's a death sentence. It is not. It is good to seek medical attention early, because you'll get the right treatment and you shall get cured. And also don't be so afraid. Sometimes you tell a mother your child has pneumonia and they're like, oh, this is so bad. So it is just an infection in the lungs and it's very treatable, and the child can get better. But the core thing is, let us prevent pneumonia, and the world we shall go to greater heights.
All right. And even the whole theme for this particular year, every breath counts. Thank you, ladies. Definitely, I've learned a lot. I hope back home, wherever you're watching us, you have learned a lot in the whole takeaways. Dr. Janet Karim, Head of Newborn and Child Health Division at the Ministry of Health. Florence Njeri, Pediatrics Clinician. Thank you very much. As well as Lillian Mutua, Head, Health Promotion in Nairobi. Thank you, ladies, for your wise words there. We're taking a short break. When we come back, focusing on matters County Diary, we really take a look at what is happening in your county and what to expect in our subsequent bulletins as well. We're also taking a look at what is